Good evening, everyone. My name is Courtney Lightfoot. I'm Managing Director of Alumni Engagement at Yale SOM. It is a great honor to welcome you to the 2020 New York City Chapter Alumni Award Ceremony. Of the many things the Alumni Relations team works on, most notably, we work with Yale SOM's vast network of volunteers all over the world. There are over 2,000 alumni actively serving at Yale SOM every single year and are all working very hard on behalf of the school to advance its mission. Class secretaries, class agents, admissions and career development volunteers, regional chapter leaders, they all advance SOM in ways the school could never accomplish without the support and strength of the Yale SOM alumni community. I am positive that many of you participating tonight have served or are serving in some of these roles, and for that, I extend my deepest thanks. I am particularly proud of the New York City Alumni Chapter and its leadership team, several of whom you're going to hear from throughout tonight's program. The New York City Chapter is Yale SOM's largest and most active regional alumni group. There are over 2,000 members, and this chapter makes up a staggering 23% of the entire Yale SOM alumni community. The chapter leadership team is a diverse team of alumni who share responsibilities, and they work tirelessly on alumni engagement efforts in New York. They hold monthly board meetings, welcome members of the alumni community to get involved anytime. They have organized countless events over the years, including happy hours, panel discussions, welcome events for new graduates, holiday gatherings, and of course, the annual New York City Chapter Alumni Award event. The group also has been active in creating affinity groups for women alumni, alumni of color, and our LGBTQ alumni. Engaging such a large number of alumni spread across class years, degree programs, sectors, and industries is not an easy task. But this leadership team holds strong to their mission to foster a community of Yale SOM alumni in the New York metropolitan area, advancing your careers and interests in business and society. And so with that, I am delighted to introduce Prem Kassett, a New York City chapter leader and a member of the class of 2011 full-time MBA program.
Thanks so much, Courtney. Hi, everyone. I co-lead the LGBTQ alumni group and serve on the New York Alumni Board. It's a pleasure to welcome you here to the third Yale SOM New York City Chapter Alumni Award Ceremony. We gather to honor alumni who have had major contributions to business and society and reconnect with our SOM community. In the past, we've honored Indra K. Nui, former chairperson and CEO of PepsiCo, Daniel Weiss, president and CEO of the Metropolitan Museum of Art here in New York, Colonel Rich Morales, professor and head of systems engineering at West Point, and Ranji Nagaswamy, CEO of Hurdle Callahan and Company. Rather than being at an iconic New York location this year, we're joining from our homes and offices from around the world. It was in our April planning meeting that we realized that the pandemic was going to fundamentally change how we need to approach this event. What we did know, though, in those early days of the pandemic was that the focus would need to be to honor the frontline healthcare workers who have bravely served our communities and continue to do so to this very day. You'll hear from Dr. Howard Foreman and some stories from the front lines with our healthcare alumni a little bit later. Spring was a scary time in New York City when we were facing the brunt of the first wave of the pandemic. New Yorkers locked down and supported each other by masking up, upending our lives, the way we work, staying at home, and doing things in a totally new way. Then came May, when we all witnessed the murder of George Floyd, learned about the death of Breonna Taylor, Tony McDade, and too many other Black men and women. New York erupted in protest, and we as the New York chapter board came together to echo the comments of our dean and the school to affirm that yes, Black lives matter. Acknowledging the diversity of our experiences, the losses we've endured, the moments we celebrated, we wanted to include the voices of our alumni in this year's event and have assembled a brief montage of your experiences and messages to our community. Please enjoy.
This year has been a masterclass in searching for silver linings. Earlier this year, I had a COVID wedding and I got married at my in-laws' place. I later found out that my father got married at his in-laws and my grandfather got married at his in-laws. So it turns out it's become a family tradition. It's really important during these times to look for the silver linings and hold on to them. And I also want to give a huge thank you to all of our frontline workers. Thank you.
I just wanted to give a huge thank you to all the frontline healthcare workers. We so appreciate all that you do every day in your jobs, at your hospitals, and for your patients. As a younger sister of an ER doctor, I'd also want to send a thank you because I know how much you do at work and then how much your friends and your family ask you to do outside of work. You might have younger sisters or friends who pestered you about anything and everything related to COVID and thought that you had all the answers and looked to you for advice. So thank you for putting up with us. Thank you for answering our questions. And thank you again for all the work that you've done on the front line and with your patients in particular.
I want to honor my best friend from high school, Dr. Stephen Wolf, who, in addition to being a really leading specialist in epilepsy and pediatric neurology, became an essential worker and a frontline worker as everybody was called into duty to try and help New York City get through the heart of the pandemic in March and April and May.
I work in customer service operations, so at the beginning of the pandemic, we had to quickly figure out how to transition from having everyone sitting in a call center assisting our customers to some sort of work from home or hybrid setup. So what we did is we put a bunch of employees up in a hotel that was right next to the center so that they could be socially distant and isolated, and they could walk to work, and where the center was a lot less populated than it had been before the pandemic started, so that they could continue taking calls safely. We got a lot of thank yous for this, which really meant a lot to me because it felt really good that we were able to think of a solution that enabled us to keep helping our customers, retain most of our employees, and in some ways, most importantly, enable them to keep supporting themselves and their families in the midst of a global pandemic.
I was actually hospitalized at the top of the pandemic in the spring, and just so thankful for the staff of the hospital and the first responders, the healthcare workers, who are all putting their lives and livelihoods on the line by coming in every day, doing what they do, taking care of us. I was just so thankful for me personally when I was in this dire need to have them be there for me.
I'd like to express my wishes for all and hope everyone is doing well during these crazy COVID times. And I also want to express my gratitude to all the first responders and essential workers who've put their lives on the line to help us get through where we are today.
The pandemic has allowed me to spend more time with my family, who I didn't see much of during the week pre-pandemic because I would leave for work early in the morning and come back late at night. Unfortunately, that meant during the week, I would often see them only once a day, but because of the pandemic, I've been working from home since March. It's actually been really wonderful to save the time that I would have spent commuting and also see my wife and children much more frequently. The last several months has actually brought my family closer together and allowed us to spend much more time enjoying each other's company, which for my family has been the silver lining in an otherwise terrible and concerning time for us.
Hi, I'm in front of the old St. Vincent's Hospital here in New York City in Greenwich Village. I just want to thank all the healthcare workers for all the stuff they do for us every single day.
Baruch Spinoza, the philosopher, had once said that citizenship is not born, it's earned. And people like Howie and the frontline heroes who work with him in healthcare definitely have been earning their citizenship over and over again many times. And we're grateful to them all. And so congratulations to everybody we celebrate and to Howie.
Hi, the goal of this event, as Prem mentioned, is to honor alumni who have had major contributions to business and society. In the past, we've achieved that by recognizing 2 alumni at the event each year, one whose career emphasized business, like the retiring CEO of PepsiCo, and one whose career emphasized society, like the president of the Metropolitan Museum of Art. However, healthcare workers, even ones with MBAs, don't fall quite so neatly into those 2 distinct categories. They tend to naturally exist at the intersection. In addition, since they're all currently on the front lines of the pandemic, there was no clear way to specifically select two of them to honor. So instead, tonight we'll have a few of them speak about their experiences over the last year and what they expect as we move forward. This discussion will be moderated by Dr. Howard Foreman. Professor Foreman is a professor of diagnostic radiology and faculty director for finance, public health, health policy, economics, and management. Professor Foreman directs the healthcare management program in the Yale School of Public Health and teaches healthcare economics in the Yale College Economics Department. He is the faculty founder and director of the MD-MBA program, as well as the faculty director of the healthcare focus area in the School of Management's MBA for Executives program. As a practicing emergency and trauma radiologist, he is actively involved in patient care and issues related to financial administration, healthcare compliance, and contracting. His research has been focused on improving imaging services delivery through better access to information. He has worked as a health policy fellow in the US Senate on Medicare legislation. Our three alumni panelists are Dr. Malika Mendu, the Executive Medical Director of Clinical Operations at Brigham and Women's Hospital, Partner Center for Population Health in Boston. Dr. Mendu is a graduate of the MD-MBA program in 2009. Dr. Emmanuel Obunwa, who graduated from the program in 2017, who's a resident in emergency medicine at the Yale School of Medicine in New Haven. And Dr. Hiromi Yoshida, who graduated from the MD-MBA program in 2011, is a clinical assistant professor at Seattle Children's Hospital in Seattle. We'd originally planned for a fourth panelist, Dr. Bennett Antwi, who graduated from the MBA and PH program in 2019. However, Dr. Antwi is currently practicing at 37 Military Hospital in Accra, Ghana, so the logistics of having him join simply weren't feasible. We'll therefore kick off our discussion with a short video from him addressing these questions of what does he wish had worked differently over the past year, and where do we go from here?
Hello everyone. I'd like to thank President Nick, the Yale SOM New York City Alumni Chapter Board, the honoree, Dr. Howard Foreman, and the entire SOM fraternity for the opportunity to share a few words at this award ceremony. I am Major Bennett Antwi, a 2019 MBA and PhD grad. Currently, I'm deployed with the United Nations Interim Force in Lebanon as Senior Medical Officer for the Ghanaian Battalion. So my comments are general and cover many experiences both back home in Ghana and in Lebanon over several months in a variety of roles in response to the COVID-19 pandemic. It's been almost a year since the first outbreak was detected in Wuhan. We are all aware of how it has altered what we perceive to be normal. In fact, people all over the world are talking about the new normal. It has even affected this event in that most of us are tuned in from our homes or offices. The world over, the pandemic is changing lives and livelihoods, and it seems there is no end in sight. However, it has also created some learning opportunities and opened our eyes to new ways of doing things. Personally, it has afforded me the opportunity to practice many lessons learned at Yale. Throughout the outbreak, I have sometimes served as a clinician and also as an administrator in the response to the pandemic. As a member of a team tasked with testing, tracing, and treating security personnel deployed during a nationwide lockdown, I coordinated activities of a multidisciplinary team, including clinical, administrative, laboratory, pharmacy, and engineering personnel. I helped organize training for various clinical personnel while ensuring that requisite logistics are made available to them for successful care of patients. I've also been responsible for a medical team tasked with administering almost 1,000 personnel through various stages of administrative quarantine ahead of deployment for a peacekeeping mission in the Middle East. This exercise was successful, and the personnel have currently been deployed. Now, I manage medical teams charged with screening, testing, and treating COVID-19 cases while leading efforts aimed at preventing outbreaks within military camps. As I have said earlier, this once-in-a-lifetime pandemic has afforded me the opportunity to learn new leadership lessons and to practice some techniques I've learned. I've learned that as a leader, you must literally show the way. You must be present and hands-on at all times. For example, if you want your staff to approach cases with confidence, you must demonstrate it yourself. Put on the PPE, enter the treatment rooms, and interact with COVID-19 cases. Secondly, the importance of drills and exercise. This cannot be overemphasized. It is important to simulate possible scenarios that could happen. Drills and exercise will prepare the personnel to adequately respond to the outbreak in a timely fashion. During the exercise period, you are able to identify some loopholes and address them. It is also important to engage all stakeholders early on in the planning process. It is crucial to identify key opinion leaders in societies that you are managing. It is important to ensure that they totally understand the situation and are able to and willing to communicate your message to their constituents. These persons oftentimes have the goodwill and trust of the people in their jurisdiction. Lastly, management of a pandemic on such global scale requires joint multidisciplinary efforts. All aspects of teamwork are required from both clinical and non-clinical personnel to have a successful response. So far, it's been a challenging but eye-opening experience. Fighting the pandemic requires joint effort from all aspects of the global community, as well as dedication and extra commitment from frontline workers. The Yale SOM New York City Alumni Chapter's decision to honor frontline workers and the choice of Dr. Foreman as the recipient of the award is a wonderful gesture. However, it will require effort from everyone to eventually eradicate this pandemic. Once again, thank you very much for this opportunity and have a wonderful program.
Thanks very much. I'm sitting here with the dog on the lap, so that avoids her barking. So just if you see a little head sitting up here, it's an invasive procedure of mine. I first want to thank everybody for having me and for having our panelists and for our panelists joining us for this. I want to mention at the start, it's really an honor for us to be able to hear from Bennett. Bennett did the 3-year joint degree program, finishing up a little over a year ago, and practicing back where he came from in Ghana, a country that, as our colleague Mushfiq Mubarak has talked about, one among many in sub-Saharan Africa that has actually performed better than most developed countries in its response to the pandemic. There are an awful lot of places in the world that have seen worse outcomes than the United States. Ghana is not one of them. It's done much better than us. And I think it is because of the dedicated resources and skills that come with people like Bennett. So it's an honor and a privilege to see him again today. We have my 3 of my former students besides Bennett here today. Malika Mendu coming from the Brigham, Hiromi Yoshida from Seattle Children's Hospital, and Manny Abundwa, who is coming to us from Yale. And the reason why we picked these 3 is that they're really operating at different stages in their career and also in different locations as well as different specialties, and have different experiences. So hopefully at this point they can put their cameras on, and I'm gonna go in a sort of roundtable format to talk to each of them about what their experience is. I think I'm gonna start with Manny, who's been working near me. I get to see him periodically in the Yale New Haven Hospital emergency room. My personal experience of watching over the emergency medicine doctors, nurses, and other personnel working in our emergency room has inspired me and made me proud of the institution and its ability to respond. But I want to give Manny just a few minutes to talk about what that's been like, both as a senior level trainee. He was at the end of his 3rd year of residency when this began, and now is in his final year of training now. And has really been witness to a lot of innovation and devotion by our caregivers and physicians down there. So I'm going to turn it over to him for just a few minutes.
Thank you so much for giving me the opportunity to speak. It was, I think, so I started off actually in the medical ICU. I was working there when the whole thing hit. And I think one of the things I was really floored by was the intense flexibility that everybody had. So when it first hit, there was a lot of confusion in terms of how we would respond. And on certain days we would have like two emails, one saying one thing and the next saying, "Oh, now you have to wear N95 masks." But I felt like because of, I guess, the nature of the people that work in and on the front lines, there was just this, okay, whatever it is, we're going to push and we're going to find ways to make this happen. And I think it was one of those things that really, really floored me. I think so. We, the flexibility. So everybody was trying to switch. I remember my last day in the medical ICU. I was signing out to a neurosurgeon, a colorectal surgeon, and an anesthesiologist. These are people who usually do not work in the ICU ever, but had decided to volunteer their times to join in because this is a pandemic and we got to do what we got to do in order to take care of patients. I think it was so great the way the organization did this, and I'll be happy to get more into that later. I think one of the things that really, and most people can kind of see from the outside, was the emotional toll that taking care of patients really took on us. I remember one that really touched me, and I think it's something that, it was kind of sad for me to talk about, but, I had one patient who, I'm going to switch things up a little bit so it's not any HIPAA, but, who came in who was not feeling well. But she came in mainly because her husband, who was immunocompromised, had gotten COVID. She had gotten it and she felt like she had given it to him, and he had come in and he was very, very sick. And she just looked to me and was like, I killed him, and was just crying to me because she felt like she was responsible for him being very sick. I think these were kinds of stories we would see when patients would come in very, very sick from one thing or another. And I was very grateful that we had wellness initiatives to be able to make sure that we were, emotionally capable of handling these types of situations. But overall, I think from the beginning, from the top of the organization, the flattening of the structure, the flexibility of all the people involved, and also the availability of information on a daily basis really made it so that these transitions that we were having were relatively seamless.
Thank you. I'm going to move over to Malika now, and she is, of the three of you, the most remote graduate of our program. And since she graduated here, went through residency and a fellowship, I think, in nephrology, and now is a quality and safety officer at the Brigham, having also done the management track in the internal medicine residency. And would love to hear how that prepared you to play a role within the institution and the institutional response to COVID in a city that, by the way, was, perhaps if not for New York, would have seemed to have been the worst hit city in the country.
Yeah, first off, thanks for having me today. And it's great to see you, Howie, and so great that you and others are being honored today. This has been, and I'm sure I'm not exaggerating when I say this, and I'm sure many on this call feel the same. This has been by far the weirdest, most difficult year in healthcare, and as a leader of a hospital, incredibly, incredibly difficult. It has also been the most inspiring year, being able to see frontline workers at all levels across all disciplines come together and provide high quality care and make incredible sacrifice. So I just want to start off by saying that. I would say, the beginning, as Dr. Emanuel referenced, was really challenging. The fact that we really didn't know very much in the beginning. we didn't have enough PPE. That was really scary in a field where we like to have protocols, especially when it relates to infection control. We didn't know if we had the right protocols, and we were reusing PPE very frequently, and that was scary. So there was a lot of unknowns, there was a lot of fear, and then, fear for patients and needing to defer care for patients because a lot of elective procedures were shut down, and some procedures that were probably not elective, that were just not urgent, that were deferred. Not having testing for patients, so having a patient who you knew was COVID positive, but then not having the testing available. But what we were able to do is be a resilient organization, as others have been throughout this, and figure out strategies to really do our best operationally. And I would say coming from this background of having a management degree was really helpful in thinking about how do you optimize operations in a really tough, critical situation. I think one example that really highlights that is thinking about the workforce, right? So thinking about our frontline providers, how do we make sure we have safe care for patients and utilize our workforce to the best of their ability? Yes, there were many people who signed up and said, put me in the ICU, but we also have to be careful of that, right? To make sure that we have the people with the right skills. So we ended up doing a lot of training, cross-training of providers in different specialties so that they were able to provide care in the ED, on an inpatient floor, in the ICU, in settings that they usually would not be able to provide care. We also came up with a really creative virtual team rounding program where we had certain healthcare workers who could not provide care in person, maybe because of health reasons or other concerns. And then there were providers who maybe were a dermatologist or a radiation oncologist, maybe very remote from inpatient medicine, who were doing documentation for teams, who were helping with discharge summaries, medication reconciliation, so that they could offload some of our frontline care workers, give them back a couple of hours a day, make sure they're able to have lunch, really recognize the burden on folks who are at the front line. So those are a couple of examples of how, I think it has been an incredibly challenging time, really inspired by people coming together. And it has been the absolute hardest operations problems to solve through, but we've been able to solve with a lot of creativity and a lot of resourcefulness.
Thank you. And I'm going to then turn it over to Hiromi, who I've known for just about as long as Malika, because Hiromi I met when she was an undergraduate, and I've really had the privilege to be connected to her for about a dozen years right now, maybe even more. And we've tried to recruit back to Yale twice, I think already. So, or maybe it's 3 times, hard to keep track. But she works in pediatric emergency medicine, and pediatric emergency medicine is unique, as you know, in that children are much less affected by COVID than adults, but does not mean that they're unaffected, and it doesn't mean that it doesn't completely disrupt the care of children during this time. And so the front line of pediatric care is as important as the front line of adult care. So I wanted to hear a bit of reflections from Hiromi on what she has experienced in Seattle, which is in the middle of an emerging second or third wave, depending on how you count it.
Yeah, so thank you for having me on this. And I see some of my classmates on the attendee list, so hello. But yeah, so I'm a pediatric emergency medicine doctor over at Seattle Children's, associated with the University of Washington. And we luckily, in terms of pediatrics, there haven't been a lot of, high volumes or seriously ill patients, which has been great, I mean, from our perspective. But when the pandemic started, echoing what everyone else had said, it was very confusing. And it was definitely like an overnight switch that happened. I remember it was February 28th, where everyone was like, there's this thing, COVID, we need to like figure out PPE, we need to figure this all out. And it was an overnight switch where we had an emergency operations committee that opened up, and I was part of the ED COVID operations committee, and there were meetings twice a week, hospital-wide, and we were sending out daily emails, probably with the conflicting information that was talked about earlier about like, what do you wear? Like, who do you test? And some at the beginning we were calling the public health department for every test we were doing, and now we just like test everyone as they enter the door. So there's been a lot of change and a lot of flexibility and a lot of resilience, which has been wonderful to see, but kind of hard to be a part of as well, especially as we get into almost a year into doing this. In terms of what we did, we also did set up tents to just in case there was a surge. I think closing schools definitely helped in terms of decreasing our volumes. Elective things like surgeries were also canceled, which decreased our volumes, which helped kind of save the PPE, and I think also decrease stress for staff, which was nice. In terms of kind of the biggest impact I think that COVID has had on our pediatric patients is how they interact with the hospital. There's been caregiver policy changes. So at the beginning, there was only one caregiver that was allowed to come with patients. So, two parents couldn't come, or children under 18 weren't allowed to come in with the patient. So we had a really hard time where, like if there's two kids and only one parent, like, what do you do with the other child? Do you leave them with a friend? But, that creates a whole issue about, well, what happens if someone has COVID and, you can't just leave them with any friend. You can't leave them with a grandparent if they're high risk. And so that's been a challenge, both on just visiting the ED, but then also, right, once you're in the ED, if you have to come into the hospital, who gets to go with the child into the hospital? So we had a lot of kind of hard, distressing cases, especially if there's a little baby who needs their parent, but their parent perhaps is COVID positive. There was a lot of discussion around who is allowed into the hospital. The baby is breastfeeding. Like, we definitely want the parents to be with that small child or any child who gets admitted. But what is safe for the hospital? What's safe for the staff? What's safe for the patients there? That's been an ever evolving discussion. And I think that's been a challenge because we always want to keep patients and families together, but we also want to do what's safe for everybody. So that's been a ongoing discussion that's still evolving today.
Thank you. I want to just briefly mention and then hopefully get quick reflections from each of you. I got the opportunity to work with three of our colleagues from the School of Management, Julia Di Benigno, Marissa King, and Amy Wisniewski, in sort of a leadership consultation on our COVID floors. And at Yale New Haven Health System, we had 27 floors at peak that were COVID floors. And what was striking to me is how much both the nurse managers as well as the nurses themselves and many of the physicians were experiencing, real, moral scar, for lack of a better word, from the ongoing trauma of seeing so many patients in the situations that Hiromi mentioned in particular, and Manny mentioned also, where you're dealing with patients in situations that previously would have seemed unconscionable. I'm just wondering, as we all, in all three of our regions here, are approaching new waves, how much has your system adapted to knowing what's coming ahead of us, and what roles have you been able to play in informing those decisions? And maybe I'll start this time with Hiromi and work backwards.
Sure. So I think we're getting prepared. Our governor just mandated 25% for kind of indoor things. Indoor dining has been closed. Schools have pretty much been remote, and they keep trying to bring people back, but they're all still remote. So I think that has been interesting. I think the big thing that we're worried about is influenza. The good thing about children not being in school, not that it's good for their education, but it does decrease the number of respiratory diseases that come into our setting. And we actually saw this in March when school shut down. We typically have influenza and RSV, which are, common viral things that kids struggle with. We usually have our highest volumes in March and April. And this year we were down like 30 to 40% of our usual volumes. And a lot of it was attributed to the fact that children weren't in school getting each other sick. And so our hope this time around is that same concept might apply. And therefore, we'll have not as many patients. That said, we are coming up with our surge plans. So we still have the tents there. We have simulations done to make sure we know when to open the tents, how to open the tents, what to have in the tents. So kind of the operations things that were talked about earlier. We also have, as this goes on, we are having staff shortages as staff get ill or are exposed. And so, we're planning for that. And then I'm one of the mental health liaisons for the ED. So we are seeing increased mental health volumes in spite of having decreased ED populations. So I do think that, this is hard. It's challenging for patients, families, and staff. And we are definitely seeing that in our patient population. So kind of in a very practical sense, we're trying to figure out if we have boarding medical patients or mental health patients, like where do we put them? Like, what spaces do we have available? And so that's kind of been an ongoing thing that we're working with. So I think we're hoping that, the viral season isn't too bad, but I think with ongoing COVID challenges, there's other things that are coming into play.
I just want to add for the audience to realize that whereas in the first wave, lots of visiting nurses, lots of physicians were able to migrate across the country to various regions to help out. Now, as you sort of have synchronous waves right now, there's an inability to do that. And that is an added strain on both physicians and nurses who feel that they can't even take a week off or a few days off because there just is no capacity in the system, particularly with so many people already in isolation and quarantine. Malika, your thoughts?
Yeah, I would say, I think that's such a great point, Howie. I would say, in Boston, we definitely feel like we're much smarter and we're much more prepared this time around. But it is very different than what we experienced in the spring. I think in the spring, at least for Boston, we had New York that was 2 weeks ahead of us, and we were able to track what was likely going to happen in Boston, and it was very similar. So we had some time to plan. We had a sense of exactly what the trajectory was going to be. There was a shutdown of elective cases, which freed up staff to be able to take care of the COVID patients. This time around, we don't know what the trajectory is going to look like. We are seeing rising numbers. We don't anticipate it's going to be as severe as it was in the spring, but we just don't know. So there's, in some ways, more uncertainty. I would also say that we know this time around that we are better prepared, and we also know the downsides of not taking care of patients who don't have COVID, right? So shutting off ORs and shutting down cases and therapies. So we're really making a concerted effort this time to try to resume all other operations. So you can imagine from an operations perspective how challenging this is when you have increased workload that's unpredictable. And so we're trying, frankly, many different creative strategies, from looking at our bed planning and trying to optimize our bed planning, thinking about flexibility of teams in terms of who they're able to care for and how many patients they're able to care for. Again, developing contingency planning around staffing. And so we've developed a plan with that respect, knowing that there are a lot of unknowns. I think what's also hard is that people, patients, frontline care workers, administrators, everybody is depleted. I mean, I think people are tired, and wellness is a real issue. We've had some caregivers who've spent months taking care of COVID patients on the front lines. And so thinking about how to support them, especially if we have another surge, is really challenging. But I will say, again, we did learn a lot from the spring. We do have, very, this time, really clear protocols around PPE, and we have enough PPE this time, and that's a big stress relief. It's much easier to ask people to help when you know that they are absolutely, have the equipment that we need. So I think we're more prepared, but in many ways, it's just a different situation than what we were facing in the spring.
Great. And last but not least, Manny.
Yeah, I want to echo everything people have said. I think, the uncertainties are abound. However, I think with the prior wave, I think there's been a lot of preparation related to this current one. One of the things we tried to do was get ahead of the flu vaccine by having various initiatives to increase vaccine. I was actually involved in one where we tried to get people to do more vaccinations on the New Haven Green, and getting a lot of the patients that are so-called frequent flyers in the ED vaccinated early on, getting them tested early on so that they were getting all the needles and things like that. Sort of like trying to tackle whatever social determinants of health we could in order to hopefully decrease the surge of visits that might come along. We've also been doing a lot of things related to harnessing technology. So I'm sure a lot of other departments are doing that, like using Alexa to be able to drop into patients' rooms in order to decrease the amount of PPE that's being used and also to decrease the exposure. The tent system is already in place and we're ready to use that, in order to get people who don't need to be in the hospital out. Thankfully, it seems like there's more tests available, which was one of the struggles we had initially, where we were sending people saying you might have COVID. We don't have the test, but fingers crossed, stay quarantined. And now there's the increased availability of tests that makes for easier discharge plans for patients. And I think just highlighting a few things like the strong backup system. In certain times there's we're 5 attendants deep in terms of backup systems, because people are we're depleting the pools of workers, and therefore how can we make sure that we are still able to take care of the patients that need to be taken care of. And then wellness initiatives. There's been multiple, thank God for Zoom. And we've been doing a lot of Zoom yoga, Zoom check-ins, and just whatever we can in order to make sure people are at bay and trying to have as much fun as possible, even in the midst of the craziness. So thankful for the initial trial run, and hopefully we've been armed with enough tools to be able to tackle whatever comes on during this next wave.
Thanks very much to all of you for sharing your experiences during this time. And it goes without saying that I think you draw upon the best skills you've learned, as well as the best of who you already are, in being both the managers, leaders, and clinicians that you've become. So it's a honor to be able to call you our alumni. I think I'm going to turn it back now to somebody, to
Hi.
Yes.
Yes. Thanks, Dr. Foreman. This is Tanmay Manahar. Hello, everyone. Thank you to our panelists for giving so openly of your challenging experiences. And hello, everyone else on the call. The New York City Alumni Chapter has a special custom when it comes to the Leadership in Business and Society Award. We have created a Maurice Cup, and every year we inscribe it with our honorees' names. In addition to the Maurice Cup, we've also arranged for individual awards for the panelists, which we're delivering as soon as logistically possible. Maurice has been a Yale tradition since 1849. In keeping with our strategic objective of being the business school that's the most integrated with its home university, over the past several years, Maurice has gone beyond just an undergraduate institution and is now part of the fabric of SOM's culture as well, to the point where it's become the venue of choice for cohort mixers, graduating class dinners, and even reunion events. This cup will remain at Maurice, where any SOM alumni can request to use it. While under the circumstances we may not be able or willing to share a Maurice Cup this year, in true SOM fashion, we hope this tradition will ensure that alumni can continue to come together and bond in the years to come. Alongside our previous year's honorees, Colonel Rich Morales, Ranji Nagaswamy, Indra Nuyi, and Dan Weiss, we have added lines to the cup for the 2020 first responders and for Dr. Howard Foreman, who is graciously accepting on their behalf and whom I would like to invite now to share a few remarks.
Thank you. I do want to just mention a few more things in these remarks. First, thank you very much for honoring the first responders and allowing me to represent them today for this event. And to all of you who have attended, I've been watching the attendee list and I see all of your names, and so many of you are really close friends and former students and people that I've remained in touch with. So thank you for being here. It has not gone unnoticed who's here. I want to mention, though, that when we talk about who are these first responders, we've invited three, actually four, including Bennett, physicians to be represented. But at the front line are nurses and so many others beyond nurses who have really sacrificed, including EMS and so many others who are giving of themselves without concern for their own safety and well-being and health. So many of them have lost their lives. In fact, so many physicians and other healthcare workers, nurses have lost their lives during this pandemic, many of whom were very young, too young to have lost their life at this stage. And so I do want to highlight that. We're talking about, 4 young people who have been able to hold up during this time, but many other people have not been that fortunate. I also want to highlight that a lot of our graduates and both in the clinical fields and non-clinical fields have played very important roles, even if not practicing clinically. I was creating a short list as I was sitting here and remembering that Charles Powell was on TV many times talking about the innovations that he introduced into ventilator care at Mount Sinai during the height of the pandemic in New York. Dr. Vivek Murthy has been, an incredible communicator and supporter of both the presidential campaign and now the transition team and the COVID response right now. Amanda Skinner has shown through her stewardship of Planned Parenthood as a trained nurse midwife, her ability to lead during these times of great adversity. I see on the call Adam Blumenthal, who's not clinically trained, but nonetheless is a leader in the healthcare field and has had to reorganize his subsidiary companies in ways to be able to respond to the pandemic and be able to sustain them during this time. I see Mark Schleingel is on the call, who's an anesthesiologist in Florida, and the anesthesiologists have been in many cases the most frontline workers responsible for having to intubate patients in the emergency room, in the ICUs and elsewhere. Ryan Schwartz is an MD MBA graduate who has been leading the response for the state of Massachusetts. And so on and so forth. I could go on and on, but I just wanted to highlight just how many people are part of what has been a successful response to an unprecedented and horrible experience for us all. Nothing has brought greater pride to me than witnessing all of them rise to the occasion, play roles, and as I mentioned, even colleagues like Amy, Marissa, and Julia in the School of Management, and fierce advocates like Jeff Sonnenfeld at the School of Management stepping up to help us with this response. So that is all to say thank you very much for allowing me to receive this on their behalf. And I look forward to a time in 3 or 6 months when vaccinations are widely available and we can go back to a new normal and hopefully a better level of preparedness for the future. Thank you.
Thank you, Dr. Foreman. Good evening. My name is Nick Hackey. I have the pleasure of serving as this year's president of the Yale SOM New York City Alumni Chapter. I have a few heartfelt thank yous to offer as we close out this evening's celebration of these wonderful people. First, let me thank our doctors, Foreman, Mendu, Obunwa, and Yoshida, for sharing your stories and insights. It's easy to fall into the trap that one's contribution to business and society is somehow greater if you're a CEO. I hope that these stories remind us that perhaps the greatest contributions are coming from wonderful people like these doctors and so many other essential humans, as Dr. Foreman was just noting. Second, a big thank you to the wonderful leadership team we have assembled and which serves as the Yale SOM New York City Alumni Chapter Board. In addition to Prem, Jean, and Tanmay, who you heard from, we benefit from the wonderful creativity of Selection Cherry, Rasana Goss, and our past president, who really galvanized us as a board, John Dayton. Third, super big thanks to Courtney Lightfoot, her wonderful team, including but not limited to Kathleen, Shannon, and Bree. They really make it all happen. A small reminder, you can still order the celebration option, courtesy of Welcome to Chinatown. This is a grassroots nonprofit started by two amazing ladies just starting out in their careers. They recognize the devastation that the pandemic has wrought in our Chinatown community in New York City of businesses. Chinatown is one of the last, if not the last, remaining cultural neighborhoods in New York City. And we're just trying to do our part to keep New York City the vibrant, ethnically diverse, and fabulous place in which we choose to work and live. Finally, and sincerely thank you for joining us this evening and helping us honor our essential alumni. We look forward to the hopeful success of the vaccinations and antivirals, which will enable our board to resume planning wonderful opportunities to gather, celebrate Yale, SOM, to network, to make new friends, and to keep up with old ones in person and not just on a screen. Whether you have an idea for us to execute on or want to take more of a leadership role within our board, I encourage you to reach out to any of the board members or Courtney or her team. The last in-person event we had was in Brooklyn at a museum where we celebrated Lunar New Year. It seems so long ago now. We look forward to celebrating with you in person next year, hopefully at our 2021 Leadership in Business and Society Award celebration, if not before. Thank you. Have a great rest of your evening or day. We have attendees from around the world. Thanks again.